Hi guys, hope you're well. Dr. Aman from Aurora Medical Education. I wanted to do a really quick video about breaking bad news, and in particular a bit that I see a lot of people do in role plays for things like PLAB 2, CSA, RCA. The bit that they put in about, do you want somebody else to be in the room with you, or do you want someone to be here when we go through the results, or do you want someone to be around when we go through the next steps? And a lot of people kind of put this line into a breaking bad news scenario because they've been taught that you need to put this line in. Basically, it shows that you're looking for support, and it's good to have somebody there or offer somebody to be there. Now, the principle behind this is absolutely correct. Okay, when you're thinking about breaking bad news, we've done a video earlier on about how important it is to ask about support systems and whether A, they want to be there now, or B, they want to be there, they're going to be there later when they go home or they start thinking about things in the future. So the principle of offering that is absolutely correct. But one thing I often see is it's kind of put in as a pre-rehearsed, well, I've just got to get this line in type of thing. And it really, the principle is right, but the understanding is not there. It's just kind of rehearsed and put in. So, for example, I'll give you an example. It might be a breaking bad news scenario where you have an X-ray report or you have some blood results, and you know you're going to have to give some bad news. Right at the beginning, sometimes people will say that line, just before we start, would you rather have somebody in with the room with you? That sounds really odd. Like, why would you say that right at the beginning? Or just before maybe the actual breaking bad news, someone will say that line, oh, just before we give the news, would you prefer if somebody else is in the room? Now, principle is correct, understanding and demonstration is not. When you start putting a line in like that randomly out of nowhere with no link, then it looks like it's just been rehearsed, taught, learnt, and it shows you don't really understand the principle behind it. However, what we talk about when we do our role plays and our practice and our courses for things like PLAB 2 and RCA and all those other ones that we do, or any kind of communication skill role play that you're doing, think about putting that line in when it sounds a lot more natural. When's the best time to do it? When's it most natural? When you're talking about people in their life already. So for example, when you're doing a psychosocial history, you're finding out things like, who's at home with you, who's involved in the story so far, who do you discuss these kind of things with. When you're talking about that, when you're finding out that they've got maybe a husband or wife, or they live with their parents, or they've got children that they discuss it with, when you're finding that information out, then maybe at that point say something like you mentioned your wife, is she around today? Would you prefer that she's in the room with you? Or, oh, you mentioned your father, you've discussed this with him, is he around right now? Would you rather he be here when we go through the results? That sounds like a much more natural, genuine, normal comment that you'd make in a breaking bad news scenario, demonstrating that you understand that the people in that person's life may well be important in this story, and therefore you are offering that they may want to be there for extra support. This is very different to what I often see in role plays, which is people just putting a random standalone, I've got to get this in type of line, whether it be at the beginning or just before the breaking bad news. It just doesn't work, and it stands out a little bit. And often the response is, well, why would someone else need to be there? And it's just, it's such a pre-rehearsed statement that it actually does worse for you. Probably it looks worse than putting it in, or probably leaving it out altogether. So when you're doing role plays and practicing for things like PLAB 2 and RCA and any communication skills, and you're doing a breaking bad news scenario, we've got lots of videos on breaking bad news scenarios. Just remember, yes, the principle of support systems and having someone there or offering somebody there is very good, but doing it in a random ad hoc way does not do you any favors. Think about, can I bring this in or integrate it in a natural part of a conversation when I'm already talking about people involved in their life or involved in the story at this point. We've got loads more breaking bad news videos, so please do watch them on the YouTube channel. Please do subscribe, share, like if you found this video useful. There's so many more communication skills, teaching and tips on our communication skills audiobooks, live courses, and online courses as well. And if you want 10% off any of those, please do use the coupon Aurora Video 10 for 10% off any of those scenarios, whether or courses, whether it's PLAB 2, RCA, communication skills, med student stuff, or whatever else you're preparing for right now. I really hope this helps. Breaking bad news, getting the support system lining correctly. Hashtag Campus will pass. Hashtag I went with Aurora. Have a great day.